whenever I have time.
Hmm. Hmm. Okay. Okay. Huh. That is nice. Um, did you give any recommendation on how you can, like, going to your boss or supervisor and being like, hey, I think this kid could use this particular thing, like, just to make them happier. Even if it was like, why don't we let these two kids kind of like just be in the same room? They could get along. They can at least talk to each other. Anything like that.
No, not really, because I didn't want to really try to, because it's the ICU, so I didn't want to really.
Ooh, I forgot that.
Yeah.
I forgot it. Yeah, you can't really do that. Um. Okay, so like you said, so they're basically. Um. Is there any other element about the pediatrics ICU that you'd like to include? Like that you could say like I really want to include this part because it's important that we mention this.
No, I mean that's pretty much it.
Okay, okay, no problem. And then what about general the general children's hospital
Pediatric
or
one. Yeah.
yeah, general pediatrics? Um, what were your responsibilities there? I mean, checking vitals, or were you the first person the kid is interacting with, or what?
Well, here the kids were way more awake, so and more hyper sometimes. So they would be asking for a lot of like water, juice, ice cream, stuff
Yeah.
like that that we had supply of. So I mean, it was checking vitals. Anytime they asked for something, you had to go get it for them.
Hmm.
Making sure they're comfortable. I mean, some of the kids when they get sick, they get really whiny and cry a lot. So you have to
Yeah.
like kind of, calm them down, entertain them with something else so they kind of just forget about, hey, we're in the hospital.
Mm-hmm. Yeah, because when kids get nervous, because like kids are so intelligent, like they understand at some level that something is not right, and our parents are scared, and that makes them nervous. So like their reactions can get very, like you said, like they can be whiny, they can be upset, they can be angry, they can be more needy than usual. It gets very complicated. Like how do you deal with them? um
Yeah. There's
it
another thing we would do is make sure we kept the routine as much as we can, like the household. So we talk to the parents and ask like when they wake up, what is
oh
the first thing they do, and that would
hmm,
make them feel more comfortable because kids don't at that age don't like being out of routine. So we kind of try to keep everything as much as we can like the house.
like if the kid stays calm, you stay calm. It's better healthcare across the board that way.
Yeah.
Yeah, I like that. I like that. Okay, that's nice. um Can you give me just a couple more details about what other stuff you would do in general pediatrics? I mean, is it also educating kids? Is it vaccinating them? What kind of age group are we talking about?
Age group we dealt with all the way to like 6 month year olds to up to like 10, 12 year olds. Uh, of course we gave them, yeah, if they need a vaccine we would give it to them. Their medications. Sometimes it would be kind of hard because they don't want to take their medicine.
Eh,
Um, what else?
Nobody likes taking medicines like when they're
Oh,
kids. They're just like, they taste yucky, or they're like, I have to swallow a pill this big.
yeah. Um,
How do you handle those situations? Like how do you convince the kid that you should?
I mean, if we're able to, we'll hide it in food and give it to them. So like, just crush it up in
Smart.
applesauce.
Huh.
Sometimes we can't do that, so we just kind of have to talk to them. Sometimes we'll ask the parent to do it because they're more willing to take it from the parent than from the nurse.
Okay. All right. Uh, all right. All right. Um, for for specifically when it comes to babies and vaccines, um, Was that a challenging situation in the sense that, like, you've got new parents who are very worried, very concerned, might be backseat nursing?
Yeah, the parents really didn't like seeing. So when we
Yeah.
did get vaccinations, obviously the baby would start crying really loud. The patients was, I mean, the parents would kind of get sad, like, oh, you might be hurting them,
Yeah.
stuff like that.
New
And we
parent
just kind of have
syndrome.
to talk to them, like, hey, they need this vaccine, and we'll make her as comfortable as we can.
Um, I am not sure about this, so please correct me if I'm wrong, but when babies are vaccinated, aren't there one or two vaccines which might, like, I just remember my mom telling me that when I got vaccinated, I was very, very cranky for like a day or two afterwards. So, like, do you also educate parents in that sense, like, hey, there could be a side effect or there could be an allergic reaction, or just here's what you should expect in the next 24, 48 hours?
Yeah, because sometimes they get like a fever after they get their vaccination
Yes.
stuff. So we would give them like if they need any medication. So just in case they do get a fever, we would teach them, give them this,
Hmm.
and just try to stay away from the side of the vaccination because it'll be a little sore. So don't put any pressure on it.
Yeah, yeah, that's true. That's true. Okay, I can work with that. Um, um, I don't know how to ask this, but like the way you deal with the 5-year old is obviously different than how you deal with like a 10-year old, right? Like different, there are different learning points. So you have different strategies in place, right? Um, I'm just wondering how that particular element came into play for you when you're in the general pediatrics ward, like, were you consciously making this choice, like, okay, I have to deal with this patient who is like 3 years old in this particular way, like I need to distract them from the pain or whatnot. But like with an 11-year-old, you can use more logic, you know like,
Yeah.
how do you handle the diversity in age, and then how do you adopt your strategies accordingly? Ow.
If it was younger kids, when we'd explain things, we would use like pictures.
Nice.
Sometimes we'd bring in the teddy bear and like show like what we're gonna do on the kid on the teddy bear and be like, hey, we're gonna do this, this. They kind of like absorb it a little more and kind of understand more. But then for like
Mm-hmm.
older kids, we can kind of just like tell them straight up what is gonna happen.
Hmm. um this particular strategy, I'm assuming, is kind of like, again, nursing best practices, right? Like,
Mm,
this is what works.
yeah.
Okay, wonderful, wonderful. um were you able to give any recommendation in terms of general pediatrics, like recommending, like, hey, we should have some toffees over here, or juice boxes should be kept in easy access, or we should have more toys in this space, or it should be a brighter color, anything like that?
Mm, no, not really. I mean, they had all that
uh
stuff.
okay. Did you perhaps recommend that whatever visual aids you had, they should be upgraded, or were they good?
Well, yeah. Sometimes if I would like recommend we use other things like not just like their teddy bear, but like any toy they had, or like show like with like little puppets,
See
kind of
what
like what we're
works.
gonna do. Yeah, see whatever the
Okay.
kids, because some kids prefer other things over other things.
Yeah, I mean, like, not everyone prefers teddy bears. Some of them might like dolls, others might like puppets, or yeah, I like that. Okay, lovely. I can work with that. Is there anything else we should talk about for this particular rotation, or should we move on?
Now we can move on.
Okay, so mental health, I want to be a little bit faster on this because it's a little outside of what you're going for.
Okay.
Um, so first of all, George, when you're on your mental health rotation, what are you supposed to do? Like, is it just about watching a patient? Is it also making sure they take their medication? What is the scope of the rotation, basically?
Observing them, making sure their medication is actually work is a big part too.
How do you make sure?
We like ask after we start giving them the medications, we kind of try to see like if they're still talking to themselves, they're still having hallucinations,
Oh,
they're still
okay,
as
okay.
aggressive as before.
A lot of observation and data taking then.
Yeah.
Okay, okay. And you were on one, two, three different sites, right?
Yeah, you can focus more on Coastal Harbor since Coastal Harbor was for kids.
Yes,
The
lovely.
rest were adults, and the Coastal Harbor is the only one where it's a mental health for kids.
What is the full name actually? Because I looked for Coastal Harbor and I got like four or five different results, so I wasn't sure
Yeah,
what's the full.
it's I wrote it right here. Coastal Harbor Behavioral Health. That's what it's called. I pulled it up.
Behavioral health. Okay, so like you said, they're focused for kids, right?
Yeah. So it's
Any
all the way
particular
from
age? Hmm,
yeah, it was like from 6 years old all the way up to 17.
17. Um, what kind of issues were did this institute help with? Like, what kind of treatment plans were they offering?
Like what did I generally see mainly?
Yeah, yeah.
I mean, there was a lot of like suicidal patients there.
Mm-hmm.
There's a lot of just like kids that are just like very aggressive that we had to help. I mean, a lot of them they actually had like mental illnesses.
Mm-hmm. Mm-hmm. When you say well, actually, I don't think there's need to elaborate on what kind of mental illness, right? Like,
Okay, yeah.
uh, yeah, I don't think so. Okay. So how did you navigate that space? Like, because I mean, aggressive people is one thing, but when it's a kid that's being aggressive, the strategy completely changes. Like, how do you handle them?
Um, Usually when we did see a kid become aggressive, we would try to separate him or her from the rest of the kids because
Mm-hmm.
usually other kids would make them even more aggressive. So we kind of try to push them to the side, kind of talk to them down and calm them down.
Mm-hmm. Mm-hmm. Did you use any particular, like, see, I want to call it like, was there any particular strategy? But like, how do you calm someone down? Like, especially when they're a kid, like you said, so like taking them out of the situation, and then what? Asking them their side of the story, asking them
No,
think about.
when they are aggressive, you're not supposed to start asking them exactly what happened at that moment because
Exactly,
that would just make
exactly.
them even more angry. So we would
Huh.
pull them to the side, make sure they're by themselves, kind of like tell them to like breathing techniques to calm them down
Nice, nice. Okay. Breathing techniques. Medicate them if necessary.
if necessary. Yeah.
Uh-huh, uh-huh. And then what? So like once they have calmed down.
Then we can talk to them, ask them what exactly happened, why did they get so mad.
Mm-hmm. That's what happened. Okay. Um. Okay, so that's a very situational kind of thing, like somebody made them mad, and then they demonstrated that reaction. Um. The other side of it that I'm wondering is like once there has been a change in medication, then are there like prescribed meetings, scheduled meetings where you sit down with them and you talk with them like, hey, how are you feeling? Do you feel more sleepy or numb since we changed the medicine or something?
Yeah, throughout the day we had special times where we'd sit down with each patient and ask them those questions.
Do you ask them directly, like, or do you feel sleepy or whatnot, or do you kind of like go about it in a more roundabout way?
No, we would ask them pretty directly.
Like, there wouldn't be any concern that the kid might lie?
Well, because we do
Or
observe
am
them
I
so
just giving
much.
them too much credit?
Yeah, we can like catch on their lies sometimes because we do observe them so much, so we kind of catch on. Like, he said he's
Yeah.
not sleepy, but he's like kind of falling asleep all the time. So yeah,
Ah,
stuff
okay.
like that.
Okay, I like that. So you have to be very, very active in observing them.
Yeah.
Okay, okay, I can work with that. I can work with that. Um, mm, what was the difference in strategies used dealing with different kids? Like the way you handle a suicidal child would be different from someone who is perhaps who has some other mental illness.
Yeah.
So, would what was your approach towards each situation or each treatment?
So if we're dealing like let's say with like a bipolar patient or something, I mean just the way of communication would be different.
Hmm.
The way we would like distance them from other patients. So like the suicidal patients, we kind of make sure there was more other patients and kind of like they're together and being like social and stuff. But then the other patients with like with bipolar schizophrenia or something, we kind of try to keep them sometimes alone, not always too social because they don't like being too social.
Hmm. Hmm. That makes sense. Like, you have to be aware of what each person's background, history, and triggers are, and avoid them as much as possible, right?
Yeah.
That can be difficult. Um, but you just have to plan as best as possible, right? Like, I mean, you can't avoid everything 100%, but you do your best anyways.
Yeah.
How would you rank the the child engagement? Like, how do you keep them as happy as possible in that situation? Because, like, it's not home, their families aren't there, they have to be upset at some level. So how do you how do you deal with that challenge?
Some patients, if they're doing good, we would let their family bring in stuff from their room, so like their Xbox, their favorite toy, stuff like that. So every time they do something good, we would like let them have something.
Hmm.
That's one
Reward
way.
positive behavior.
Yeah, and make sure it's like something that's from their room that they really want. Or like
Nice.
we would let them wear certain clothes. So sometimes they would pretty much wear like a uniform outfit for everyone,
Hmm.
but if they were like being good, we would let them choose their outfit for the day, stuff like that.
Nice, nice. Small things that can make their mood better.
Yeah.
That's very nice. That is very good. uh how were the families in this case? Like, how do you handle them? What was their scene like?
I honestly didn't see a lot of families then, so when it was more like schizophrenia patients or bipolar patients or stuff, their families didn't really visit that much. It was more of the kids that were suicidal that would see their family more
Hmm.
and check up on
uh
them.
yeah, that makes sense. And how were your interactions with those families? I mean, they're obviously concerned about their kid. So how do you talk to them? What do you want? What did you convey to them? Like, here's what you should do, here's how you can help, here's our strategy, here's the role we want you to play in it. How did you what did you do in that front?
Um, so a lot of times because the certain patients that especially with suicidal will be because of their parents sometimes. So sometimes the parents weren't
Eesh.
allowed to see the kid at all. So, I mean, we would talk to them and tell them as much as we can about what's going on, and we would kind of plan with them when they think would be a good time to kind of discharge them and get them back to school and back home.
Actually, that's such an interesting point that you brought up. Like, you know, a lot of times it is because of the parents that the child winds up taking such a drastic measure. So when you sit down with the parents, do you have to explain that to them? You know, like, I'm not assigning fault here, but you know, you were the reason behind this, so
I mean,
here's
yeah,
how you can.
we would tell them kind of how the patient feels and why they did
Exactly.
whatever they did, and try to give them ideas on how to improve the household and make them happier and like everyone happy in the household.
Wonderful. Exactly. That's what I was hoping for. And would that also include recommending them therapists or like family counseling and stuff like that?
Yeah, we actually had at Coastal Harbor family therapists that would sit down and like counseling and stuff.
Ah, wonderful, wonderful. Okay, perfect, perfect. Um, what else? What else can we talk about here? Um, did you organize anything for the kids? You know, like movie night or something else, like, you know, some other fun activities for them.
We organized and like they would have like gym time. So they would ask us ideas of activities they should do in the gym time, and we would kind of help organize some games like we kind of knew and teach them to the kids so they can play along.
Wonderful. So one thing that you did touch upon is breathing techniques, right? What were some other things that you would teach kids? I mean, like, how can we generalize it that you taught them techniques to help better manage their anxiety or their rage or, like, you know?
Yeah, like the techniques I taught them, or just you want?
Both would be nice. Like, you know, like it was in this area and I was teaching them techniques or physical exercises to help them. You know, just
Yeah,
an
we taught
overview
a
of
lot
that would be nice.
for the kids that got really angry and would just snap and like try to hit someone. We taught them, so once you start feeling angry, to like how to start their thought process and how to think about the situation and how to calm themselves down before they actually just go and attack the other kids.
Wonderful, wonderful. So it's like techniques and I think, yeah, techniques and strategies. I think that's the best way we can summarize it, right?
Yeah.
Okay. Okay, we've talked about that. We talked about that. Uh, is there any other element that we should talk about here? Like, what kind of data collection would you do here, actually?
Data collection about like either
Like,
than vitals and stuff.
yes.
We would do a lot about their mood, things they said throughout the day. That was very important. That's different than the hospital setting. So, like in the hospital setting, we wouldn't record things they say, but here we would make sure to record things they said, especially if it's something weird. We would record
Yeah.
their mood, their behaviors. If they're doing something out of the ordinary, we would record that.
That reminds me. Was there a defined format or